Overly tired.
Well, good afternoon, everyone. It's Amy Conley here with United Way of Door County. Most of you know I am our executive director, and we have been spending some time each week for the past few months now introducing you to the programs that we are investing your donor dollars in. So today we are here with Washington Island Community Health Program. Usually we call it WICHP, because that's a much less of a mouthful. So we've got two guests with us today. So ladies, do you want to introduce yourselves?
Sure. I'm Christine Anderson. I'm the Executive Director of WICHP.
And I'm Elise Haller, and I'm the Office Manager of WICHP.
Well, wonderful. Thank you so much for joining us. So I know WICHP does a lot, but if you could take a few minutes to kind of summarize your services for our viewers today, that would be great.
Sure, we're happy to do that. So WICHP was formed to help serve primarily seniors on Washington Island many years ago, and to make better connections with some of our community partners on the mainland. Our primary goal is to keep people in their homes safely and independently. That usually focuses on older age adults, but it does apply to any age on the island. We certainly help people of all ages, so our majority of people are older, like in the 60+ category. The funding that we get from United Way funds a program of ours that's called the In-Home Supportive Care Services, which has like 6 key components. The first component is, it can comprise of like home visits and office visits, where we meet with people and discuss services. And if we go out in the home, we do like a safety check, we can do blood pressure checks, we can help organize medications, those kind of things. We also work with a variety of community partners on other programs. We work with the Aging Disability Resource Center in Sturgeon Bay on the Meals on Wheels program on the island, which after COVID is now consistently serving Monday, Wednesday, Friday. And in addition, we got to start a frozen meal program last year, which has been a huge success.
Wonderful.
Yes, it's been a great service. We work with Neighbor to Neighbor, another community partner, on their medical equipment program. So that helps provide a great need. Being on an island and not having accessibility to a lot of things readily does help people, with, recovering from surgeries or illnesses, and it helps keep them safe in their homes. If they're elderly, we want that walker, we want that commode, we want those things in their home so they can stay there to help with that goal. Advocacy is another program we do and that is pretty much anything we can do to help somebody. It can include facilitating referrals and services. It can be going to a doctor's appointment and helping them understand what's going on. It can be helping facilitate a smooth transition from rehab back home to the island, which, as you know, we have geographical barriers. So we want to make it as smooth of a transition as we can and get as much set up ahead of time as we can to make that happen. We work with the Washington Island Ferry Line, DoorTran, and Door Cancer. Those are other community partners on our medical travel fund program. And that program is designed to offset ferry expenses for those who need to travel for rehab services or cancer treatment. And the last component of that in-home supportive care program is Life Assist, which is putting in the personal home monitoring devices. And we work with Door County Medical Center Life Assist Department on providing that service up here on the island as well.
Wonderful. That is a whole lot of stuff.
Yeah. It is.
It is, and it's so necessary. I think when people ask me, like, first, right, as Door County residents, we all just get the, what's it like living in Door County in the winter, right? But then there is also that, what's it like to live on the island and how do they get anything? And I think, Christine, you just gave us a really good overview of how island residents, primarily seniors, are getting access to those healthcare services. So I think that's great. I know on the island, probably everyone knows how to reach you, but if somebody is watching this and maybe their relative lives on the island and they're thinking, oh, it would really be great to get mom or dad or grandpa connected to that service, how would they contact you?
So they can call our office, which our number is 920-847-2108. We also have our website if they want to go in and explore a little more about what we do, and that is www.mywicchp.org.
Okay.
We also have a Facebook account. You're welcome to contact us via our Facebook page. And we respond to the personal messages usually within under 24 hours.
Okay. And that's what I was gonna say. The office, sometimes there's no one there, just like our office, right? There's when we're
Correct.
all out doing our jobs. So if people leave a message, you'll get back to them as soon as you can.
That is correct. Yes. And if we're not in the office, one of us is delegated with checking that voicemail at least once a day. And oftentimes it's more than that. Oh.
What did you say, Elise? We didn't catch that.
Would you like our emails too? She's asking.
Oh, sure. Your emails would be great.
Okay, so you can email us at WICHP77. So mine is WICHP77@gmail.com. And Elise?
Mine is WICHP, WICHP 54246, which is our zip code, @gmail.com.
Okay, wonderful. So lots of ways to contact WICHP, and I know, so you mentioned Doortran, you mentioned Neighbor to Neighbor, and for those who have been following our weekly interviews, you've heard from both of those organizations as well. And I think that's really important to highlight, is that we really want to fund organizations that serve the entire county, but it's really hard for a lot of our Sturgeon Bay based organizations to serve the island. So that's where WICHP is such a valuable partner to us and to all of them. We are really happy to have you as that partner. So thank you for all that you do. You mentioned a few things along the lines of health that people might wonder, like, who is the person that, are you qualified to do this? So Christine, I know you are a nurse. Can you just remind people that
Sure.
you provide certain types of services, but not certain types of services as well?
That is correct. So my background is in nursing. So I am a registered nurse and I do maintain my current Wisconsin licensing. I do not function as a home health nurse, so there's a little bit of a fine line there. We can go in and do, a lot of visual type of assessments, but if it's starting to get into an area where you might have to make a decision on what kind of treatment do you need for something, then that's when we're reaching out to our healthcare providers on the island. And we do have a good working relationship with our clinic, which is provided to us. They're a piece of the Door County Medical Center program. So they are a component of that. So we work closely with them if we need to. Or we're happy to get on the phone and make those phone calls if somebody is just like overwhelmed and can't deal with it. Or we can get on the phone and call Nurse Direct and get that after hours advice and kind of help figure out a plan.
Good. Yeah, because that's one of the questions I get is, do they kind of know what they're doing, right? And it's, yes, she's a registered nurse. They know what they're doing, but again, they also know what their boundaries are. So they're not afraid to pick up that phone, make that referral, and get people the necessary services needed.
That's correct. So it is a fine line, but I've been doing it now for a while, so I kind of have that down.
Yeah.
So
good.
But we do get asked that question a lot, and and we do get calls from like case managers at hospitals and want to know what we have, kind of services we have up here. And they're like, well, they're going to need home health and they're going to need home PT. And I'm like, I kind of need to stop you right there because we don't have that, but we can certainly work with the PT and let's talk about what you're needing in the way of home health. Or is it something like a family member can be taught to do? That's usually the way we try to go with that.
Okay. Good. Well, that's a little extra information. That's always helpful because when people are dealing with sudden health situations, or it was sudden and then they were in the hospital or at rehab and having to come home, it's a lot of decisions to make and a lot of information to process. So it's great that you're there to help with that. So thank you for that. So I know you've watched some of our other partner interviews, and we end each of our interviews by talking about ALICE. So for our viewers, ALICE stands for Asset Limited, Income Constrained, Employed. So really folks living paycheck to paycheck. But it does also include our senior population. So even though they're not employed, they're still getting a paycheck of sorts. They're getting a Social Security check or something like that. So when we think about WICHP and what we've talked about today, how does WICHP support the ALICE population on Washington Island?
Well, our services that we provide, there is no cost to utilize, like coming in and talking with us or having one of us come out to your house. And many of the programs that I mentioned earlier have no cost or like a minimal cost to them. So, you know, we do not charge for our services. That we do educate people and let them know that we are funded solely by grants and donations. And we do have some very wonderful, consistent donors who have been touched by what we've done or have heard by what we've done. COVID kind of helped us in that respect. We got our name out there a lot more. We are definitely well more known in the community. So that's been a huge help. So if there is a service we are going to connect you to, and we know there's some sort of a fee involved that may present a financial strain on them, then we are talking with that provider to see what we can work out with that individual provider on a case-by-case basis. But
So not only are your services either free or low cost, but you're advocating for those clients when they might need reduced rates on other services.
that's correct. Like, you know, the ferry fund, it offsets your ferry cost. We can't take it all away sometimes, but we can help reduce it. And if there's other issues, then we have a lot of other contacts. Maybe we can figure out some sort of a creative solution to covering those other expenses for someone.
Wonderful. Well, thank you so much for spending time with me today. I appreciate all that you, Elise, and Christine do for our Washington Island community, but also for our Door County community. Christine, as she mentioned earlier, is that connector between the island and the mainland. So she is on the mainland and serves on several committees and boards to make sure that the island residents are getting the best services possible and being that advocate. So thank you so much for all you do, you guys. We really appreciate it.
Yes, thank you, Amy. We appreciate all that you do and all the support that we get from United Way, especially during COVID this last year.
Well, thank you. We were glad that we could help out. Really appreciate it. All right, guys, you take care. Bye-bye.
All right, see ya.
Bye.